Today I'm going to talk about heat-related effects on the heart and what are the symptoms you should be watching, and when is the time to call 911 and how to take the precautions. I am Dr. Gautam, interventional cardiologist at Norman Regional Hospital. The heat-related complications are actually seen more often in elderly people if they are more than 65 years of age, and especially in children also if they are less than 15 years of age. People who have a heart disease, they do have to take extra precaution during the summertime. Make sure you're drinking enough water, keeping yourself hydrated. Heat can affect a lot of heart conditions, especially if people have a diagnosis of heart disease. Whenever the temperature is high and you are outside working for hours, it can cause dilation in the arteries, and that drops the blood pressure. That can lead to lightheadedness, dizziness. You feel like your heart is racing, and a generalized weakness, or in extreme stage that there may be a mental confusion. That's the time to stop and get inside the house. There are certain symptoms you definitely should call 911 if you feel like you're going to pass out or you have passed out for a few seconds. Your heart is beating fast, like 130, 140 times a minute, and also if you're having a chest pain, you need to call 911. When the blood pressure drops, then the heart rate tries to go up, and if you continue to do it, then you could have a fluttering in the heart, or heart is beating fast and develop atrial fibrillation. And if that happens, you may end up going to the ER. So these are the early warning that you want to monitor. And ultimately, it can lead to dehydration if you are staying outside in the heat too much. And once the dehydration happens, then it can cause a lot of electrolyte imbalance. It's important when they are out in the heat that you keep yourself well hydrated. When dehydration gets worse, blood can get sticky, and it can cause even a heart attack or a stroke. If you needed a stent in the heart, then you're on certain medications that can slow down the heart rate. So if you are out in the heat and you're taking those medications, then heart will not be able to increase the heart rate. So that will decrease your blood pressure further. If someone has a congestive heart failure history, they are taking diuretics. So if you are out in the heat and you're taking diuretics, then you're going to get dehydrated much faster than normal person. Also, you're on certain medications that goes through the kidney. So when the dehydration happens, kidney function goes down, and those medications can get accumulated in the body and cause more side effects. When people are working outside in the heat, just make sure you go early in the morning. As if you are going for a walking, you want to do early morning walk or after sunset. You want to drink plenty of water before exercise and during the exercise and after the exercise. If you have to stay out in the heat, you need to take breaks. Just get inside and hydrate and then go back.